Hello and welcome back to my channel. Today I'll be talking to you all about alopecia areata. Alopecia areata is an autoimmune disease that causes hair loss, and there are three types. The first type is alopecia areata totalis, and in this particular type, the hair is lost from the face and the scalp. The second type is alopecia areata universalis, and that's where the hair loss is pretty much global. So it's lost from the face, the scalp, as well as also the arms, the legs, everywhere on the body essentially. The third type, which is also the most common type, is called alopecia areata patchy, and it actually causes patches to form on the scalp. These patches are actually bald spots, and they form when the person is attacked by this particular form of alopecia areata. And we generally see this form in adults. The other forms, universalis and totalis, are generally found in children initially, and they grow up and they basically tend to have the same pattern of baldness, as well as hair loss pattern. This particular hair loss pattern or symptom is also found in other autoimmune diseases such as systemic lupus erythematosus or lupus or SLE, Sjogren's disease, and mixed connective tissue disease. So for alopecia areata, you either are diagnosed at a young age, or you can be diagnosed or in your 20s, or you can be diagnosed in your 40s. It really has a big range. So they don't necessarily have to have a diagnosis when they're 5 years old and it graduates up to their adulthood and they're still having these problems. People are diagnosed also at different points of their life. So let's just keep that in mind. So when there's a young patient diagnosed with alopecia areata, they're generally given or prescribed a steroid cream. And essentially the parent or the guardian would apply the steroid cream where there's a lack of hair or where there's hair loss. However, with the adults, they have a more extreme approach to the medications that they're prescribed. So the first type of medication that I ran across that was a little bit extreme to me was the corticosteroid injections to the scalp. And I just thought it was a little extreme because, first of all, the scalp is a very sensitive area. It's not as sensitive as the face really, but it's just as sensitive. And I just couldn't see myself in that situation with the doctor in tow with a needle and saying, okay, this is gonna sting a bit. I couldn't see that because, I understand sometimes you need medication and sometimes injections are the order of treatment, but to the scalp, it almost makes you scratch your scalp. Number two, it's not as invasive, but it's something that it's a little bit much, and I still would be a little bit on the edge if I was actually prescribed this particular medication method, and it is the use of anthralin. Now with anthralin, it's doctor ordered to where you have to keep the cream in your scalp for about 2 weeks or 3, and then the doctor has to call you for you to wash it out. Now, mind you, I probably would have had a panic attack at the first week because if that stuff does smell bad, I'm sorry. Bald spot or not, we're gonna find some other method because that's just no. And lo and behold, it's COVID season. I hope the person ain't got COVID because I mean, you gotta wait for them to call you to wash your hair? For real. I mean, to me, I was like, nope. I passed, doc. The next type of treatment approach that the dermatologist uses is the minoxidil or rogaine method, which, I mean, most people know about rogaine. You can actually get it over the counter. I believe they still, however, prescribe rogaine to the patients, and that actually comes in a foam or a cream. And they pretty much, you just follow the instructions. You can actually wash that out as soon as you apply it, so you won't have any problems with that. And then there's another method, of oral medications that are also given or prescribed to the patient as well to help with hair growth. From what I've read, there is a disclaimer in regards to all of these types of hair growth regimens, and that is that it may not regrow your hair. And that needs to be stated, because if you do wait years, on end, and you try to come for treatment or try to contact a dermatologist to regrow your hair, chances are that all of your hair won't come back, because a lot of the follicles would have died by then. So if you do see a pattern of hair loss, you need to contact them as soon as possible. The window that you do have is between about 3 to 6 months. After that, it's going to be kind of hard, depending on the situation, for your hair to grow back. There are also other methods as well that are more natural as well, not downplaying the medication. I'm just telling you that, if it was me, the injections probably would not be on my list. And the anthralin would surely not be on my list. But however, if that does work for you, you should go right ahead and go do that. But I do also encourage you to take upon yourself to take some natural approaches. Because when you take the natural approaches, a lot of the times the medication starts to become a reduced factor in your life. So just say that the medication is kind of like a promoter. It's basically promoting your body and basically having your body to be, or forcing your body to do something. But if you keep that up and lean on the medication, your body won't be able to really act the way it should or act normally, because it's used to that promoter saying, come on, wake up, do this, do that, or instead of just doing it. So what you can do is the following. Number one, you need a stress log. Everyone that's fighting an autoimmune disease needs a stress log. You need to write down what's stressing you out, and my suggestion is give it to God and let Him handle it. Because if you keep handling it on your own, using your own methods of stress reactions, you're not going to make it. If the person that cuts you off is now the person that you're basically shooting curse words at and the finger, that's not handling stress correctly. Number two, you're causing your body to go into a frenzy of autoimmune responses. So you might want to write down your stress SIRS, because chances are if you keep going the way you're going, cursing out your son or cursing out your boyfriend because he did not put the toilet seat down, all of these kinds of things. You may be in a hospital and it's not going to be good for you, because you're going to need so much more to bring you to a state of function. Number two, if you have people that are negative in your life and you know who these people are, and you know how they make you feel every time you're near them, you need to limit yourself with them. I know we want to help people. I know we want to be there, especially as women and things of that nature. But if they're killing you on the inside with their words, their thoughts, and what they do outside of being near you, with other people, then you don't need to be around them. They're just going to just bring you down. And you may not see it today, but you're going to notice it. For example, you had a goal to lose weight, but every time you look around, you can't even get to the gym half the time because someone's crying on the phone, or someone's basically saying this and that, and they need this help, or they need you to come pick them up because somebody kicked them out their house. And I'm not saying don't help people, but I'm saying is this: don't let people hinder you from your goals. There's a limit, and there's a boundary, and you just have to set that boundary. And if that person comes back and starts scratching you in the eyes, their boundary is Jesus. They need to hit that boundary. And cry out to him for help, because you can't help them. They need the Lord, period. Number 3, you need to totally limit foods that are toxic for your system. For example, they're called toxic fast food and toxic junk food. I call it toxic junk food and toxic fast food because there's fast food that you can actually buy that's not toxic. So limit those foods, because those foods actually have additives that are against your body. For example, there's a sweetener called high fructose corn syrup. Now, high fructose corn syrup has been discovered to block your ability to absorb vitamin D. Now, vitamin D is very important to us. Why is that, Dr. Mackey? Because vitamin D actually helps our immune system so that we won't have as many flare-ups. It actually helps with the inflammation. It helps the brain to react so that we can actually fight for ourselves on the inside. We really need to not eat foods or drink beverages that have high fructose corn syrup as an additive. Number 4, if you know that you're allergic or intolerant to it, please limit it now. So if you know that you have this allergy to peanuts, but you love paydays, I understand that you like paydays, but if it's causing you to have flare-ups, especially if it's anaphylactic, you need to stop killing yourself, ma'am or sir. If you have an intolerance to cheese and other dairy products. How do I know I have an intolerance to cheese, Dr. Mackey? Well, let me tell you. So case in point, if you're eating pizza and after you eat the pizza, you notice that you have an extra set of mucus that's coming from your nose into your mouth, and you can't blow your nose because it's stuffy, and when you try to clear your nose, you see a lot of nasal matter just coming out your nose. Chances are you're intolerant to it. If after you eat a bite of cheese, you start scratching because you're breaking out in hives, that's an allergy. And you definitely need to stop eating cheese and other dairy products. The reason why I picked cheese as well as also peanuts is because those are the main two that people actually are intolerant to or allergic. It doesn't have to necessarily be cheese. It can be anything such as milk, yogurt, anything with dairy, anything that contains dairy or dairy products. However, there are others. So if you know that when you ingest or eat any of those products, that you have some form of reaction to it, just limit it, because it's going to affect your immune system. So it's not just that you're battling an autoimmune disease, you're also battling your immune system being attacked, because you ate something that you were intolerant to or that you were actually allergic to. And last but not least, please, number 5, make sure that you're eating foods that are not toxic, period, as far as grocery store items are concerned. When you go to the grocery store, try to get the most organic products as possible. Now, I know some people may not agree with me. They probably will come for me because I'm doing this video in the first place, because a lot of people say, well, you can say that, but there's so many companies that are lying about them being organic that you really can't say, oh, well, eat organic foods and you'll be all right, because they probably are lying about them even taking the organic stance. So you're probably eating a food that you probably could have bought 10 cents less, because about half the time they're lying. Well, I'm not going to debate that. I know that there are some people that are out there that are lying, but that's not always the case. So your better bet is to just go with the foods that actually are coming from an organic farm. You have to also add that the USDA does do a lot of testing, and EWG does testing as well. So my suggestion is that you do buy foods that are organic, because you are safer in that you're not ingesting those pesticides or those insecticides that they can't get rid of even through processing. It's better for your health, because it's not just the food item that's causing the problem, it's the environmental toxins as well. It's the toxins that are placed in the food. When they state that, oh, well, tomatoes or what is causing your lupus flare up, or your Sjogren's flare up. Well, that may be the case if that person is eating or ingesting a conventional tomato or a conventional eggplant. However, if they switch to an organic eggplant or an organic tomato, they probably won't have those reactions, because it's the environmental toxin that's causing them to flare up. If they were to perform a blood test to actually see if they have this particular toxin or that particular toxin in their bloodstream, they probably would find it. If they performed an allergy test to determine whether they were allergic to, let's say, Roundup, which more than likely they are allergic to that, they'll see that they'll see all the hives popping up near that area. So there are many factors that go into play in regards to why someone would have a flare up. And in this particular situation, it's not just, oh, it's the tomato, or oh, nightshades, get it off the list. No, many times it's the pesticide or the insecticide that they're ingesting over and over again that's causing them to have that flare, or that kick them over toward the full-blown Sjogren's disease, or in this case, Alopecia Areata. So this concludes my video. If you like this video, please like and subscribe. And as always, thank you very much for watching, and I look forward to serving you in the next video.